Hello, my name is Andrew Katavas with MedicareQuoteForYou.com. Thank you for joining us today. Today we're going to be talking about Part B of Medicare. The reason why we started putting these videos out is because there's been so much confusion about the different parts of Medicare and how they will actually contribute to your health care. And we wanted to really get rid of the confusion. And the way that we do that is by educating our clients and making sure that they understand the different parts of Medicare. Now, there are other videos that we've put out on Medicare Part A, also Medicare Part D, and also Medicare supplement plans. But today we're going to be talking about Medicare Part B. Now, Medicare Part B, defined by Medicare, is what we would call preventative care. But it includes a lot of very important things. For example, doctor's visits. Also, preventative care in the sense of diagnostic tests, x-rays, lab work, blood work, all of these things that can help keep you out of the hospital. That is the goal, to find something before it becomes a major issue to keep you out of the hospital. And this has been something that has the ability to really save a lot of money for the American economy as well. If we can find things when they're small before they become major issues, we can keep medical expenses low before people are in the hospital, and that's when the medical expenses go through the roof. Now, Part B of Medicare covers you at 80%. And when you think about 80%, let me really quantify that. If you went to a doctor, and let's say it was a specialist, and he charged $300, Medicare would pay 80% of that, and you as a consumer would be left with 20% of that, meaning that out of your pocket you would be responsible for $60. Now, the cost for Medicare as of 2011 is an average of $115 per month. This comes directly out of your Social Security check. This is a little different than Part A of Medicare, which essentially is no cost now because you've paid for it through your working years in the form of taxes. Now, Medicare Part B also has a $162 annual deductible. Notice that I said annual deductible. If you contrast that to the Part A of Medicare, which has a per benefit period deductible, there is a huge difference. Having an annual deductible means that at the beginning of the year, when you go to the doctor or you get a test done, you're going to be responsible for the first $162. And then after that period of time, it's going to be an 80-20 plan. Now, there's two main services that Medicare Part B covers. There's medically necessary services. This is defined as services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. And there's also preventative services. This is health care to prevent illness or detect it at an early stage when treatment is most likely to work best. So again, this gets into that money-saving component where we're finding things before they become major issues. Now, at MedicareQuoteForYou.com, the reason why we put these videos out is because we really wanted to educate our consumers. But we also do this via talking on the phone, emailing. You can go on our website and click to chat. You can also click to call. You can just call our 800 number that you see down below at 888-790-2321. We work with all of the major companies throughout the states that you live in, and we are very, very versed with the laws of Medicare and how they affect you specifically. At MedicareQuoteForYou.com, we want to help.